First of all, I'd just like to acknowledge the traditional owners on whose land we meet today. Particularly the elders, and before they said the Purga elders, well, that's my background. My grandfather was a Waka Waka, born in Anango, and he was actually put on Deebing Creek, which was the name before Purga. And my grandmother's actually a Kalkadoon, and they actually married on Purga in about 1926. And in those days, they had to actually get permission to marry. It's very honoured to be here today, and I thank Uncle Albert for inviting me. And looking at his pamphlet, A School of Excellence, that rings true to my ears too, because I'm in the process of building a Centre of Excellence in Indigenous Primary Health Care. What I want to try and do is relate my journey with education and relate it to health outcomes. I grew up in Cleveland, and I went to Cleveland State High, and I was the first actually Aboriginal person to actually do grade 12 at Cleveland State High. I have 6 siblings, four sisters and 2 brothers, and there's very much disparity between the education that my siblings received. I was the first one to have a higher degree and go to university. A couple of my brother and sister actually went to opportunity school, I used to call them back in those days, and so they had very poor schooling. And all the studies show that if you have good education, you're less likely to smoke, drink alcohol, and not exercise. So it's very important to have a good background in education. For example, if we look at smoking rates in Aboriginal people, they're between 60 to 80%. We've done some work and some research at our centre, and for our health checks 15 to 54, the smoking rate is actually 67%. So in the general population, it's less than 20. So we need to get those messages out, and education is very, very important in delivering health messages. So as I said, I went to Cleveland State High, and then after that, I went to Gatton College, and I did a Bachelor of Applied Science in Food Technology, and I worked as Assistant Quality Control Manager over in Edgells, which is on the Manly Hill. There's a factory there for many years, and only recently has it been torn down and housing put on it. So I worked there until 1985 when I started medicine. And why did I start medicine? I read an article in the paper about no Aboriginal person or person of Aboriginal descent had actually done or completed medicine at the University of Queensland. So with a science background, I decided I'd give it a go. At that time I was age 30, I was married and had a little girl 2 years old. That little girl now is actually in second year medicine, which I'm very proud of. So then I started my journey at university life, and meeting at that time it was an undergraduate course, so all the students were actually from high school. You know, they were 18, 19, 20, and there's about 4 or 5 of us that were older, and as I said, I was 30 years old, and they used to call me actually grandpa. But anyway, they used to come to me for advice. But I remember they used to always try to get me out drinking, and I used to say, look, I've been in my first degree, I've done all that, so I had to knuckle down and actually study because I couldn't afford not to pass. So once I finished medicine, I worked in the PA, did my internship there, and then I went to Anala probably about 1994, started in the community health centre. And at that time, there was only 12 Aboriginal people that actually attended the University General Practice, only 12. And Anala has quite a high population of Aboriginal people. So using my educational skills, at that time I had a Masters in Public Health, so I had research skills. So I wanted to find out why Aboriginal people didn't access the centre. So I did some focus groups, found out why, and some of the things was quite simple. No Aboriginal person working in the centre. You know, Aboriginal people like to come into a centre and see a black face. There's nothing there that Aboriginal people identify with. If you go there now, you'll see heaps of paintings and a mural on the wall by local people, so they feel part of the centre. So over the years, it's been, people would probably know Noel White, who's an Aboriginal person, and it's been the Noel and Nola team now for 16 years. And we've developed that service from 12 Aboriginal people. We've got over 6,000 Aboriginal people on our books now, and we complete about 1,500 doctor consultations a month. And again, using educational skills, we do what we call continuous quality improvement. So we audit our books every year, so we know we're actually doing better and having better health outcomes for our patients. So it's been a really important journey, and there's the problems I see now is with our youth. And if you talk about education, if you look at school retention rates, up to about grade 10, they're very similar, non-Indigenous and Indigenous, but 11 and 12, it drops off dramatically, and that's where the problem is. And what I see is those young people, they end up in actually juvenile detention. In our juvenile detention, it'd probably be 60 to 65% are actually Aboriginal in our juvenile detention. And if you look at the correctional centre overall, in Queensland, Aboriginal people make up about 3 to 4% of the population, but in our correctional centre it's 25%. And if you look at the NT, it's up around 80% actually Aboriginal in correctional centres. So we need to do more work to actually get those younger kids back to school and education. And I see here the new Himba Yamba learning and listening place will actually have a creche for those older students to actually come back and finish their schooling. Schooling is very important, and as I was saying, with my family there's a big divide about our educational standards across my siblings, and the ones with the poorer education actually have diabetes. My brother had a heart attack at 50. I have a sister with diabetes. I have another brother that's probably be going on renal dialysis soon from diabetes. And myself, I've been pretty lucky. Probably not lucky because I exercise most days. I'm still a bit overweight, but I still play squash 2 times a week. The knees are paying for it now, but I still play. My wife says you should give it up, but I won't. But I still keep playing. So exercise and good lifestyle is very, very important. And being a young Aboriginal man, I did smoke before I did medicine. So I quit smoking when I became an intern in 1990 and haven't had a cigarette since. So with those skills that we need to build a foundation for a better future for our people. And another important project that we're doing within our health centre is HIPPY, which is an early interactive home tutoring system where tutors go into the homes and help parents tutor young kids. And anecdotally, we've seen really good results with that. Feedback from parents saying the kids are more prepared for them when they go to school. So I see health and education very important and very much linked. And as I said before, all the studies show the better education you attain, the better health outcomes for you and your family, because you pass it on to your family. So the things I wanted to do in my lifetime with my kids was keep them out of jail, like I was saying before, the high rates that we have in our juvenile detention and correctional centres, and give them a good education. So I've actually succeeded in those areas. They've all did grade 12 and better, and so I'm very thankful for that. Now, as I was saying before, with this vision, and I like that bit, School of Excellence, because with all the success we've had out of Inala, Anna Bligh has actually given us $7 million to build the Southern Queensland Centre of Excellence in Indigenous Primary Health Care. It was announced 2 years ago, and we'll start building probably next January. And it takes a long time to actually do a build. My brother-in-law works for the Redlands Council as a project officer, and when I told him about the money, He said, won't have a brick laid in 2 years. And I thought, oh no, that won't happen, but it has. So it takes a long time. So I see it no different for this project here. It'll take years to actually get the build up and get going. But it doesn't stifle you. You've got to keep on driving to improve educational and health outcomes for Aboriginal people. And I'm very blessed with all the doctors and the staff I have at Inala. We very rarely have people leaving our staff. You know, I have doctors that come there and have stayed and still stay there. And to provide a good service and continuity of care, you've got to have doctors that are very dedicated in Aboriginal health. And with the new centre, we'll be focusing on teaching and research. Now, research has been a dirty word. It probably still is in a lot of communities. But with Aboriginal people leading the research, I think we can make inroads into health improvements and educational improvements. I'm lucky to have a local Aboriginal girl, Chelsea Bond, who has a PhD and is manager of our research and teaching. And over the years, we hope to build up a strong focus on not only teaching medical students, which we do, but also young doctors. I've found over the years young doctors sometimes lack confidence when they actually speak to Aboriginal patients in consultation. They don't know how quite to handle it sometimes. And with our service, we want to teach these young doctors how to work efficiently and effectively with Aboriginal people so we can have the best health outcomes for them. So I see a strong future, not only in your School of Excellence, but also in the Southern Queensland Centre of Excellence in Indigenous Primary Health Care. And I'd like to wish Uncle Albert and all his crew all the best in the future. And I do believe Himba Yumba, listening and learning place, will become a reality and big as big in the years to come. Now, I heard before people to say open their wallets. Well, I'll start off because I just want Uncle Albert to come up here because I'd like to personally donate $2,000 to their fund.
What a great role model. What a great role model and mentor. This one of our own, locally bred, and it was just awesome to hear what he had to say. Look, generously, he's put up $2,000 towards the school already, but he whispered in my ears that there was a painting there he favoured, so so I think we'll have to do a bit of a deal here somewhere. But thanks very much, Noel, because I've lived in Noel now since 1968. I've seen the wonderful transformation for people like myself that's, you know, got the best professional medical service that anybody could have. You know, we're five-starred, and you know, like, you know, the numbers speaks for themselves. You know, I remember, you know, the Murrays. They used to go down the park. They wouldn't go near medical centre. They wanted to drink themselves to death, eh? And as Dr. Hayman said, Nola White, she's a certified sister there. She used to go down there and almost drag them up. And, you know, to a peak now, where there's at least 6,000 of us there that get the best medical service that anybody could have. Thanks.
I'd just like to finish off with saying, as I said, I got 7 million. I really wanted 20 million. So I might be having one of these fundraising dinners too. Thank you.